Is it possible to clean 30-year clogged arteries? Yes, it is possible, and I will tell you how. When we say clogged arteries, we mean cholesterol, fat, and calcium deposits in the arteries, which we call atherosclerosis. It's just like a kitchen drain that clogs when debris builds up and blocks water flow. Arteries can become blocked when this atherosclerotic plaque accumulates. The process of arterial clogging is extremely common because after 30, almost 80% of people have clogged and narrowed arteries at some level. The process of arterial clogging is insidious because it is silent. You will not experience any symptoms until the blood vessel diameter is reduced by more than 50%. But fortunately, the process is slow and gradual. Serious narrowing of the arteries requires around 30 years to develop, so we have time to reverse the process and clean the arteries. Studies consistently show that ultra-processed food intake increases the risk of cardiovascular disease by around 30%. Now, let's explain what ultra-processed means. It refers to any food, including cereals, that contains added sugars, oils, artificial colors, and preservatives. So, what is the problem with ultra-processed foods? The main threat is their high sugar content and high glycemic index. They usually contain lots of sugars and unhealthy additives. This causes rapid absorption of sugars into the blood and leads to glucose spikes. This high blood glucose increases inflammation in the blood. Inflammation damages blood vessels, and damaged blood vessels are then clogged by cholesterol. For example, steel-cut oats and rolled oats are considered healthy, whereas flavored instant oatmeal packets are considered unhealthy and ultra-processed. For comparison, steel-cut oats have a glycemic index of around 45 out of 100, considered low, while instant oatmeal packets have a glycemic index of around 70, considered high. The higher the glycemic index, the faster blood glucose levels rise. Method 6. Add omega-3 to your diet. According to studies, regular intake of omega-3 reduces heart disease risk by around 15%. Omega-3 reduces inflammation in the body and also improves the structure of nerve cells. Another crucial point is that omega-3 counterbalances omega-6. Omega-6 is used to synthesize inflammatory cytokines, whereas omega-3 reduces inflammation. The typical Western diet is full of omega-6. We intake 20 times more omega-6 than omega-3, and their balance is disrupted in most cases. Among foods, fish such as salmon contain a high amount of omega-3, mackerel, sardines, and other fish also contain omega-3. Around 1 gram of omega-3 is considered optimal intake. When a person already has heart disease, sometimes higher dosages are recommended. Long-term intake of omega-3 is safe. Plant-based omega-3 also exists. Flaxseed, chia seeds, and walnuts contain omega-3, but it is not as effective. It is in the form of ALA, which is 10 times less effective compared to omega-3 from fish. Avocado also contains omega-3, albeit in very small amounts, but it provides other healthy fats that are also beneficial. Method 5. Adequate intake of core nutrients. The fifth most important method for cleaning blood vessels is an adequate intake of core nutrients such as vitamin D, niacin, and vitamin K2. Usually, we are unable to obtain enough vitamin D from foods. That's why taking it as a supplement is crucial. Vitamin B3, also called niacin, is widely available in meat and nuts. Vitamin K2 is part of the vitamin K family, which is essential for calcium regulation. Vitamin K2 helps direct calcium to the bones and teeth and away from soft tissues and arteries. This function is crucial in preventing arterial calcification. Vitamin K2 is found in fermented foods and in eggs, in small amounts. Most people on a modern diet have a vitamin K2 deficiency. Method 4. Optimize sleep. The fourth important factor for healthy blood vessels is sleep. At least 6 hours of sleep is crucial for lowering cortisol and insulin spikes. 8 hours of sleep is optimal and can improve cardiovascular health by around 15%. Method 3. Regular physical activity. The third important factor is regular physical activity, especially combining high-intensity interval training with strength training that focuses on large muscle groups, for example, the legs. Exercise significantly enhances blood flow, improves endothelial function, and aids in the reversal of arterial plaque. Meta-analyses consistently report that regular exercise can reduce cardiovascular events by approximately 25 to 30%. Method 2. Adopt a whole food, plant-predominant diet. The second most important factor is to adopt a whole food and plant-predominant diet, such as the Mediterranean diet or the DASH diet, which is rich in vegetables, fruits, whole grains, legumes, and seeds. For oils, it is better to rely on avocado and olive oil and to reduce the intake of refined carbohydrates, sugars, and red meat. Method 1. Weight loss. And the first, and one of the most important, factors is weight loss. If you are overweight, reducing around 10% of your body weight improves endothelial function and the condition of blood vessels by approximately 30%. Weight loss and improved vascular markers have moderate to strong correlations, as confirmed in many meta-analyses. Although a normal BMI ranges from 18.5 to 25, the ideal BMI for cardiovascular health is considered to be between 21 and 23. For example, if you are 168 centimeters tall, the ideal weight will be between 60 to 65 kilograms for both women and men.